we've got a few people ask about which low-level laser you recommend. I mean, maybe recommend is the wrong word. You have one that you use.
So there are so many different brands, so many different options. I would say that when you look at the research on it, we've got the 400 to 700 nanometer wavelength. So when we look at all lights, it's all on a long spectrum of wavelength.
Yeah.
400 to 700, the energy is absorbed by the mitochondria. So literally the energy producing part of your cell absorbs that. You remember how proteins work? So you have like these misfolded proteins, they can't fire. What happens is when mitochondria, when the compounds on there absorb the energy, they go back into a better shape and they start producing energy again. I think the reason that low-level laser with the 400 to 700 nanometer wavelength works is because we know those mitochondrial function go down. COVID was a great example of that. So COVID, you have this infection and your mitochondria shut down and basically become a little bit like an immune cell. You have a reduced energy production. So let's say I have the flu. I don't want to be producing a bunch of energy. I want to just, dedicate all resources to getting better. But we know that a lot of medications cause mitochondria to function. Chronic pain, unfortunately, can cause it. Depression, all these different things that can affect it. So when you have the 400 to 700 nanometer wavelength, what you're doing is up-regulating the mitochondrial function. It produces more energy, which allows the nucleus to produce a signaling cascade, basically to say, hey, we're in better shape, let's shore up things.
So in answer to the question, they should be looking for 400, 700 nanometers rather than, say, a particular brand of laser.
If you go 800 to 1,000, you're moving more into the wavelength's going to be absorbed by water. So we've got water obviously in all our cells. So as the water absorbs the energy, it starts vibrating more. As it vibrates more, it creates heat. It might be super low level heat, but there's heat there. And then what's going to happen is blood flow is going to come in to disperse that heat, and that blood flow is going to bring with it energy, proteins, carbohydrates, all that stuff, which will help. So they both have their camps. So if you have an 800 to 1,000, fantastic. The only reservations with the 800 to 1,000 is that even though it might be super low heat, 1,000 is infrared, so you're getting heat production there. So you want to have a little bit of think of what the injury type is. So I see quite a lot online of people doing 1,000 nanometer on concussion, and they've only got like 3 lasers on someone's head. I would be a little bit hesitant about that, thinking it might be low heat that you're putting in, but do you want to heat up brain tissue? Same with nerve injuries. So if I've got a raging carpal tunnel, is it helpful to heat that carpal tunnel? Some lasers have both. So some will have like a 600 nanometer wavelength and a 800 nanometer wavelength. And the last thing to say on it is whether it's a real laser or whether it's an LED. So a true laser, if you imagine we're sitting in the studio and we put an LED light bulb above you, we'd see all of you, but you'd probably also see some of me and we see some of the TV because that LED scatters. It would bounce off you, bounce off me and go to the camera so people can see us. So you see you and clear, and then you see these kind of murky shapes around. LED bounces. It's not all in one line. Whereas if I put a laser above you and shined it onto your head, everything else would be darkness, and we see this little laser point on your head, because laser all works in exactly the same. It's exactly the same. It's all exactly, like, say 600. It's exactly the same. So the idea with laser is that the energy output is exactly one wavelength, and it's absorbed better, right? That laser's not going to bounce off your head and then hit me. It gets absorbed by your skin. So the idea is that with LED, you often need higher wattages or higher milliwatts to make up for the fact that the energy is not being absorbed as much. So you have to put it. The problem is with more energy, more wattage, you get more heat.
Right.
So it's a complicated subject.